Not all chiropractic care is the same. In this video, I will tell you how Corrective Chiropractic helps you recover from disc degeneration naturally. So stay tuned. Hello, my name is Dr. Kristina Turkewitsch and I am a corrective care chiropractor in Newmarket, Ontario, Canada. I help women over 40 feel strong in their bodies again by treating the root cause of their disc pain, not just covering it up. Today I'm sharing 3 ways we use corrective chiropractic care to help heal degenerative disc disease naturally. Chiropractic is not just for temporary relief, but when done in a corrective way, there are 3 ways it heals your discs naturally. The first way is structure. Now, this is your spine. Now, the primary function of the spinal column is to protect your spinal cord, which is in behind here. When everything is in proper alignment, that is when all things are functioning normally and your nerves are functioning at 100%. Now, perfect alignment means that from the front or the back, your spine is straight. But from the side, you have curves. So you have a curve in the neck, a curve in the mid-back, and a curve in the low back as well. And when these curves are present and in the appropriate degrees, your nerves are transmitting signals at 100% capacity. Also, when your alignment is good, then biomechanically, the weight and stress going through your spine are equally distributed. So when you have a misalignment, so something like that, let's say, that is when your nerves start to get choked off. So when these misalignments or subluxations are present, it puts a lot of stress on the physical structures of the spine and also on the spinal cord and nervous system. Subluxation occurs because of any chemical, physical, or emotional stress on the body. And when this happens, the spine has to adapt. But unfortunately, when it adapts away from normal. This puts a lot of physical stress on the spine, increasing degeneration up to 200%, which includes the discs as well. When this happens, we start to lose those natural curves in the spine. And so your neck will start to straighten out, the mid-back starts to lose its curve, the low back starts to straighten out as well. And the pressure really starts to build up on all of the structures, including the disc. This is when degenerative disc disease starts. The discs will start to compress and dehydrate until it starts to create a lot of dysfunction and put a lot of pressure on the nerves. You can end up with disc bulges or disc herniations, and symptoms can start to arise without any specific injury occurring. Essentially, the spine just can't take the pressure anymore, and then all of a sudden, the smallest movement puts you into traction and you have to stay in bed. So having the proper curvatures in your spine is super important to your disc health. And this is what corrective chiropractic is all about. The structural integrity of your spine. We work to improve and correct those spinal curvatures so we can get them as close to normal as possible. And this way we can take the pressure off of the disc, which in turn takes the pressure off of the nerves. And when that pressure is reduced or taken off, then the disc itself can actually start to begin to heal. So structure of the spine is so important to a healthy disc and disc health in general. Having correct structure in the spine leads to the second way that corrective care helps to heal your discs, and that is posture correction. Because posture will always follow structure. When you have a decreased curvature in your low back and then you add some sort of postural adaptation to that, so let's say one hip gets higher, or you have some rotation, or you have a slight listing in the low back, or when the spine moves out of center and goes more to one side or the other, that increases the pressure on your disc by a crazy amount. And again, this is a lot of the time when you end up busting a disc or getting a disc herniation. The pressure and the angle of that pressure starts to be too much, and your disc just really can't handle it anymore. Not only could you get disc herniations or disc bulges, but if the pressure is constant over time, the disc will just naturally compress and naturally shrink, creating a lot of problems as well. And then one day you bend over to pick up a sock and you can't get back up again. Getting adjusted regularly gives your brain more proprioceptive information about the joints, the joint position, and the position of your body in space. So as we do the corrective adjustments, your brain gets more and more information about how the joints should be properly positioned, and then your posture will start to correct naturally. So this is a question I get a lot, patients will ask me, oh, what exercises can I do to help correct my posture? Like what can I, do in the gym that's gonna fix my posture? And the answer there is that there's actually no specific exercise alone that will perfectly correct your posture and correct the structure of the spine, because we actually have to work on the structure of the spine in order to properly correct your posture. And so exercises are really important, and there are postural corrective exercises that we do recommend, but we really need those corrective adjustments so the brain is getting that information about where the joints are supposed to be positioned. And so then over time, naturally, your posture will change without you even realizing it. And patients are so shocked, they'll be like, oh my gosh, somebody told me, just yesterday that I'm standing straighter, my posture looks great, and I'm not even trying. I love hearing those stories because it's the corrective adjustments with that information going to the brain that's really just naturally over time correcting that issue. As the structural components of the spine become aligned, those postural adaptations start to diminish, and your body slowly goes back to its set point, its normal state, and your posture will improve, which is awesome. Once your posture starts to correct, the muscles that support your spine will start to relax, because until that point, your spine was relying on those muscles to keep it stable, because we've lost those natural curves, the natural alignment. And so your body will rely, and your spine will rely on the muscles to help stabilize everything. And so over time, when those muscles are starting to wear and starting to get tired, they get really tight and they start to compress and they give a lot of issues, they start to create more problems. So over time, as we do this correction, get the structure corrected, start with the posture correction, the muscles can then start to relax. And so then actually muscle endurance and core stability will start to improve. When these things start to take place, your spinal discs and spinal integrity, as well as the integrity of the disc, can start to heal properly. Now, once we have a handle on the structure and the postural aspects, the third part that helps the disc heal is movement pattern retraining and corrective exercises. So movement pattern retraining or movement mapping is a rehabilitation approach that uses exercises and sensory feedback to retrain your brain and your nervous system to create new and healthier ways of moving. And it replaces those old, inefficient ways that you were moving before. So those movement patterns were there because of the structural misalignment and the postural adaptations that had developed from that. And so muscles weren't firing correctly or in the proper order, and you had to just deal with how the pain was causing you to move, and you were moving out of fear because of a pain sensation that you were having. And so this type of rehabilitation helps us to retrain your brain to realize that, we don't have to move like this anymore. There are new ways that we can move and safe ways that we can move. So it's about retraining those neurological patterns in your brain. So your body and your brain forget the correct movement pattern and replace it with an easier one. Unfortunately, what happens is your brain and body may want to keep the improper movement pattern out of fear of re-injury and because of pain avoidance. And this is in cases especially when the injury has been there for a long time. So it takes some repatterning to get the brain to realize and understand that the correct movement pattern is safe again. Ultimately, movement repatterning improves function and healing and reduces injury risk by teaching your body and brain to find its ideal zone of tension and movement. Now, postural corrective exercises, so the second part to this phase, focuses on postural correction via a mirrored image exercise and also specific tractioning exercises. So for example, if we've noticed that your neck has straightened out considerably, well, we prescribe, first of all, a traction exercise to do at home. And this traction exercise basically helps stretch the ligaments on the front side of the spine that have become contracted. And so it's contributed, because of that contraction, contributes to the loss of neck curve. So we need to stretch out that ligament at the front so that your neck can naturally move better into its correct posture. And in terms of a mirror image exercise, so let's say if your shoulders are translated or shifted over your pelvis to the left, well, we start to give you a postural correction that will start to shift you more to the right. So then over time, your body and your brain get that information, especially the brain, right? The repositioning and proprioceptive information. And then it starts to correct. It's like, oh, I'm not supposed to be to the left, I'm supposed to be over more towards the right. So with these two approaches of exercises and movement, we can add them to the corrective adjustments and get actually a quicker turnaround in terms of pain reduction and overall healing. So it's a way that we can try and get you a quicker result at a little bit of a faster pace. Some people can tolerate it, some people can't. So again, definitely need a chiropractor to direct this type of exercise prescription. This three-sided approach with Corrective Chiropractic offers more than just adjustments. It targets structure, movement, and long-term recovery. This method doesn't just relieve pain. It helps treat the root cause of your disc pain, helping you feel strong, stable, and confident in your body again. So thank you so much for watching. If you like this video and found it valuable, please consider giving it a like and consider subscribing to this channel so you can get more information about how to strengthen your body and keep it strong and healthy as you age. And of course, please leave a comment if you have any questions. You know you are ready to feel strong in your body again. And you know that whatever you do, you want to make sure that it's correct and tailored for you. So I'm going to walk you through the next steps that you can do to start healing yourself from the inside out. So click the next video so you can find out how to get your personalized treatment plan.